Hi, I'm Charmaine James. I'm here with Dr. Lewis, and we were going to talk about ulcers. And ulcers seem to be a big problem plaguing the barrel horse world, from horses not coming in the gate to not running hard during their runs, and just poor performance. What have you found with ulcers and the best way to treat them and to look for them and so forth?
Well, any athlete, equine athlete's susceptible to ulcers. You know, they're prevalent on the racetrack, for example. They're probably looked for a little more on the racetrack than they are in other events like rodeo, or cutters, or what have you, any performance event. But they're common, more common than people realize. The only way to really diagnose them is with a gastroscope, long, flexible scope that you can sedate. You really don't even have to sedate the horse that much, believe it or not, but you can pass these standing into their stomach and look. You have to take the horse off feed for a period of time so you can see the stomach lining. But that's the best way to diagnose them. You should be suspicious of them if your horse just changes attitude, it's not himself or herself, particularly if they not performing well. Some other symptoms are discomfort after eating or not eating well, not cleaning their feet up, laying around more than normal, and just a little bit of an overall dull attitude. Ulcers is one of many things you should consider, and like I said, the best way is to diagnose them is to scope those horses. Some people don't have the availability of a place to go to get that done right away. I do know people that'll call and they'll start treating a horse and they'll see a response to treatment, and they'll call you back and say, well, this horse really responded real well to one of the products or something. Well, that's probably informative, you know, if that's what they've got. But it's best to go off a diagnosis for a couple of reasons. Number one, you're specific to know what you're treating. Another thing is if your horse is not responding, you got a baseline to go on if you come back and rescope a horse and try to evaluate how they're doing. There's a lot of drugs on the market today. The old ranitidine and cimetidine that started years ago for humans. I'll back up. You know, in human medicine, a lot of people forget this, but the general surgeon's bread and butter procedure was surgery, abdominal surgery, to manage ulcers in the human patient. And when ranitidine and cimetidine and then ranitidine, which are the old Tagamet and Zantac, came out, well, they nearly eliminated that field of surgery, if you don't know the truth. And those drugs are very effective in the horse. Tagamet, which is cimetidine, is 3 times a day. Ranitidine or Zantac is 2 times a day. And then along came omeprazole, which is a different class of drug, and it works differently. And that is by far the most commonly used one today in the horse, and it's a 1-time-a-day drug. It's very effective. But we still see the occasional horse that responds better, I think, to some of the older drugs. So we still use some of all of it, all of those products, treat them.
I have a lot of people tell me, well, I think my horse has ulcers. I give him apple cider vinegar and some of these natural treatments, and I still see some symptoms in their horses. You know, they're real sucked up looking, they're not running hard. I just don't think they're really getting to the root of the issue, you know, believing that a lot of those, just a supplement type thing is going to cure those ulcers. And
yeah.
Some things may help more than others, but I mean, at the end of the day, to me, scoping them and knowing what you're dealing with is ultimately going to be the best.
Yeah. There's some products out that anecdotally may have some benefit in preventing ulcers that are supplements. I wouldn't argue that. They may or may not have been proven. But in my opinion, once you have a horse that clinically has them, you've pretty much got to go to one of the proven drugs to really have any impact treating those things. And I agree with you wholeheartedly. The best thing you can do is scope them. And that way you got a positive diagnosis, what you got.
And as a trainer and competing, you always want to know when your horse acts a certain way what you're dealing with, because you don't, if you're competing and you're on a time schedule trying to win some money, you can't be, as soon as your horse starts to show that sign, you don't have the time to sit around and wait and mess around. Well, I don't know what it is. At least you just know what it is, treat it, and you're way ahead.
Yeah, that's right. And you know, ulcers are kind of insidious. They kind of creep up on you. So you may not, you know, it finally hits you that you got something wrong with the horse, and you're kind of doing this, saying, well, you know, there's something been wrong with this horse for 2 weeks, but you just couldn't quite get a handle on it. You finally get there because they kind of creep up on a horse. But just as dramatically, some of those horses respond very, very rapidly to those products, and they're a different horse in 2 or 3 days, and that's a really good sign.
I agree.
Yeah.
Okay, great, thanks.